we can constantly increase the salary of the CEO. Those are the top, but we have to fight so much to add a dollar to the hourly rate of nurses. And I saw how the population of people that were affected by the COVID-19 virus were way more at a specific postal code compared to the other one that I worked at. And I think that's one of the reasons why some organizations take nurses for granted, because they know we will not abandon our patients.
I'm really excited to try this too.
Yeah, so that's a goosey soup. It's made with some like seeds.
Okay.
And then the seeds are blended alongside some other very typical Nigerian spices and herbs.
The rice or
That you can run on the side, are fine. Yeah, we normally eat this with any types of solids like pounded yam, amala. It all depends on what you like. I actually eat it with white rice too sometimes. Yeah. It's my favorite soup.
When you landed here, was it easy to find taste of home?
Oh my gosh, no, very difficult. Yeah, because you really have to. First of all, we have some Nigerian grocery stores, but they're not accessible. Like you have to first have a car to get to the shops, and also you have to know where they are. Really, like you have to be connected within the Nigerian community to know that they even exist.
Yeah.
Now we have a lot more than when I got here. So I just had to adapt at that time and adjust to the Canadian foods or whatever was available.
How much has changed since when you started becoming a nurse to the present day?
Oh yeah, a lot. When I was a new nurse, we used to have nurse-patient ratio like four patients, max 5 patients to one nurse. As of last year, we were having 10 patients to a nurse. Like I remember this incident where I actually transferred my patient who was leaving the critical care to the floor, because usually when they leave critical care, they first go to the floor before they're discharged home. So I was actually transferring my patient to the medicine floor. And when I got to the unit, the nurse was so busy. She had 9 patients. I felt so bad. I felt like, should I just stay here with you and take care of him? Should I go back with this patient? But it's not within my power. But just seeing a fellow colleague struggle so much, even though we struggle in critical care, but at least we're not dealing with 10 patients. It felt so wrong to leave that patient with her while I, went back to wait for a new admission. So, and you can see the frustration, the struggle, the anger. Oftentimes we take it out on each other, but it's not really like we have something against each other. It's just basically the stress of the work.
Yeah.
It makes it hard to make friends in a profession, really, because you're always snapping and being frustrated. It's really difficult.
You saw all of these problems that were happening within your profession and became an advocate for equity, not only for nurses, but for healthcare.
Right.
What were some of the things that were happening around you that led you to devote so much of your time in your life to advocacy?
That's a really good question. First of all, just from my experience working at different hospitals, I traveled to different hospitals to work as an emerge nurse or a critical care nurse. I see the differences. I see how the services that people are given really are based on your postal codes. It's obvious. Sometimes even the equipment that are available at different hospitals are based on the postal codes. The availability of hospitals actually based on postal codes as well. Like if you see the Durham region, we have I think about 9 or 8 different hospitals, like the small ones, the bigger ones, and all that. Whereas if you go to Brampton, they have the 1 or 2 hospitals catering for a larger population of people compared to Durham region. So traveling to the different hospitals opened my eyes as to what the equity issues were, like who was getting sane, who couldn't access care, like people who were coming to emerge without their health card, no fixed address, and it got amplified during the pandemic where I actually was just working from one hospital to the next, and I saw how the population of people that were affected by the COVID-19 virus were way more at a specific postal code compared to the other one that I worked at. And just walking through the ICU and seeing all those people who were connected to life support machines, and they were mostly, people are visible minorities, and also seeing that those were people without paid sick days. Those were people without that were mostly living in crowded areas. Actually, made the message really clearer for me that okay, this is an equity issue. This has nothing to do with everybody getting the same quality of care. It's not working. It's not happening. Someone has to speak up.
Not only are there so many barriers, but there's long been so much mistrust within the healthcare industry within these communities because of mistreatment for decades and decades and decades that has been both systemic and structural.
Absolutely.
So where do we go from there?
It's tough. When it comes to nurses, we do know that majority of the nurses who work on the front line or work at the bedside are comprised of Black, brown people. This is why much attention is not being paid to improving the working conditions, because those who are really benefiting are at the top positions or in middle management. We call it the cappuccino effect, where we have the white people at the top and we have the Black and brown people at the bottom. We are all impacted because at one point, it doesn't matter your color, irrespective of your color, you're going to need healthcare, and you're going to need healthcare that's patient-centered, that you can trust. And if that's not available to you, it could be a matter of life or death. I've seen nurses get injured and going through the eye of a needle just to access help, or to be understood, or to be accommodated as to what the other options are. Because, you have to go through a whole lot of, workplace injury stuff, and oftentimes you're blamed for getting injured, right? Because it's more like you expected to do this job for 30, 40 years and never get injured. Isn't it ridiculous? We're constantly lifting people, moving people, helping people recover over time. And just with the workload the workload that has increased dramatically, nurses are bound to get injured on the job. But when that happens, nurses are blamed oftentimes for getting injured. And then going through administration and all that to get help can be very challenging. And then getting that accommodation to be able to come back to work and still be, useful is often a big challenge. And I've seen nurses who have gotten into some deep form of depression just from that, and not being understood, and being blamed for sustaining an injury. And it's really demoralizing to know that nurses give so much of ourselves only to get almost nothing back. It's not like we want to get something back, but at least give us the care that we need when we need it.
So the lack of care within an industry that is providing care is one of the root causes of why we have a nursing shortage in the first place.
Exactly. Exactly. Isn't it ironical that a profession that's based on caring is so lacking of that same element when it comes to the people who provide care, when it comes to supporting the people who provide care. And I think a lot of it is really because it's, first of all, it's a female-based dominated profession, and there's very little attention paid to improving the working conditions because we're mostly female. And the fact that most of the frontline nurses are mostly racialized. They're Black, brown, indigenous people, so who cares? We can constantly increase the salary of the CEO. Those are the top, but we have to fight so much to add $1 to the hourly rate of nurses. As a matter of fact, why don't we just freeze their wages with a bill called Bill 124 for a number of years, irrespective of how much they worked during the pandemic. While we see CEOs make more money, while we see MPPs get, increase in their salaries and all that. So yeah, there needs to be an emphasis on improving the working conditions, and sometimes we say it so much that it's almost like a broken record. But improving the working conditions has to happen in order for people to receive good care, to receive any care. Nurses who work part-time or casual just because they have to manage family responsibilities do not have access to a lot of services, like the mental health support and some benefits that are available to full-time staff, even though they actually work full-time hours and sometimes more than full-time hours because they're trying to juggle family, but they want to make their own schedule. And it's the system is so rigid that you have to hold that full-time position. And when you do that, it's almost impossible to have a work-life balance. So nurses opt for part-time positions while working full-time hours, but while being excluded from a lot of benefits, like paid sick days and stuff like that. A lot of nurses are not being able to pay. They're not able to pay their bills. People are not. People are losing their homes. People are not able to afford rent just because of the salary. While I was driving here, I was hearing on the news a nurse who, like a criminal who impersonated herself as a nurse. I think Birgit Umaigba-Omoruyi for a couple of years. She injected people with fentanyl. She did all sorts of things. She was not caught. She was not caught for months. She was able to practice. So if that could happen in a country as rich as Canada, then why are we afraid of transitioning highly qualified, internationally educated nurse into practice? People that can be vetted, to people that can, we can go through at least a short, rigorous program where they could understand the values and culture here in Canada to be able to practice. So we have those nurses, but yet we allow criminals to practice. Like, really? So transitioning internationally educated nurses is a big one. Mm-hmm. And then when it comes to licensing nurses in academia, there has to be there has to be increased admissions for nurses, for people to choose nursing. People who want to choose nursing, it's still very competitive to get into the nursing profession. I heard about a registered practical nurse who tried for 5 years just to go back to school to become a registered nurse. Mm-hmm. Way too many red tapes. She was not able to, and she just gave up. And she decided to continue being an RPN, which is a registered practical nurse. So we can remove those red tapes, make it a little not easier, more efficient for people to pursue nursing, to choose nursing, have more seats for admission so that we can tackle the shortage, because the shortage is far reaching into many years from now, and we cannot graduate nurses fast enough. So the earlier we started addressing it from now, the better for every one of us. Yeah.
I mean, that instance that you just brought up, it's like no wonder why people are saying the healthcare system's collapsing.
Oh, yeah.
Our system's collapsing.
Yeah.
But then I think when people say that, they just forget that there are people that are also just waking up every single day so it doesn't collapse.
Yeah.
So that people do have someone at the hospital.
That's right.
That's the one thing that is like missing from that.
That's true. That's true. That's really important. There are nurses that are picking up those extra shifts, that are filling in, like they're filling in for the shortage. They are working those extra hours. They're during the pandemic, nurses stayed back to work 16 hours. Even though it's unsafe to do so, when you work in certain areas that are really high acuity, you cannot leave your patient at all. You can't. Like, if my shift ends at 7 p.m. and I have a patient on multiple life support medications, I can't leave. Even though my babysitter leaves, I can't leave. I cannot leave that patient. Mm-hmm. You have to hand over to somebody, because this is someone's life that's at stake. So nurses have held that. Nurses have done that. And I think that's one of the reasons why some organizations take nurses for granted because they know we will not abandon our patients. And because of that, they're not really addressing the shortage as fast as they should.